Thank you, Premier. Today's number is not a great number. We know that. It shows us why we need to continue our very substantial efforts to slow the spread of the virus, to put a cap on the numbers that we might get to until enough of us are vaccinated. But 120 is still far less cases than we would have seen otherwise if we hadn't had the restrictions that we've had in place and continue to have in place. It shows that applying the pressure avoids cases today, that is avoiding dozens of cases next week, hundreds of cases next month, thousands of cases. As the Premier said, there was some modelling done by Burnett that suggests that with the restrictions that we put in place since this most recent outbreak, we have avoided around 6,000 additional cases. But it's not just those historically averted cases, it's the 1,700 cases that would have been added today in that modelling. It's the more than 2,000 cases that would have been added tomorrow. Those cases increase by about a third every single day, more than 3,000 cases per day by the end of the week if we had not applied these restrictions. That is a very substantial caseload avoided for people's avoidable illness, hospitalisation, ICU, and indeed deaths. And it's tragic that we've had 2 deaths, our first deaths so far this year. We can avoid more deaths. I think the risk will continue as cases increase, obviously, but we have to be focused on just what we can avoid here by doing the right thing. These restrictions absolutely do work. And all the hard work put in by every Victorian over the last few weeks has protected our health system. We've got far fewer cases in hospital by virtue of all of that fantastic work. But to ensure we stay protected, we do have to have these restrictions in place until that first dose reaches 70% of the eligible population. That is about 3 weeks away. It could be faster. With those 70,000 additional AstraZeneca appointments that could be filled, it could be faster. With people reaching out to their GPs and the state hubs for any additional Pfizer appointments that come up, we can get there faster. But until then, the 5 reasons to leave home still apply, and they are more important than ever. It is shopping for essential food and essential supplies, authorised work only, and study, care and caregiving, exercise, and of course getting vaccinated. Wearing a mask remains a critically important intervention. Wearing it correctly all the time is really important. We'll continue to assess the day-to-day epidemiology and as the Premier said, in regional Victoria, it is on the right track. It is looking much more positive, and we'll make a decision in the coming week on exactly what we can do in regional Victoria. 7 of today's cases were in regional Victoria, including 5 in Shepparton, which goes to show that regional Victoria will remain at risk. But the 5 cases in Shepparton were all in quarantine for their infectious period, so these are small but positive signs. Absolutely, it's tough, and 3 weeks seems like an eternity. That light at the end of the tunnel is too dim and the tunnel is too long, but it is a light at the end of the tunnel. It is the genuine pathway out of here that means that we can take those small steps forward bit by bit and not have to take backward steps again. But it is such hard work for parents, for kids, for whole families, and for single people. For all of us who miss that human contact, for people we haven't seen in weeks and weeks and weeks. I do want to recognise the sacrifices and the wonderful work that so many millions of Victorians have done to get us to this point, to allow us to be positioned that we can protect so many Victorians and protect our health system at the same time. It's taken a couple of weeks for our case numbers to go from 50 to 100, so that increase is slower, much slower than it could have been otherwise, but it is an increase, and that's why my advice has changed. It's not to say that the efforts aren't as substantial as they've always been. It's a recognition of the reality of Delta, and of the fact that despite all of these extraordinary efforts between contact tracing and between millions of Victorians following the rules, we are still seeing a slow and steady increase. So we have to move as fast as we can to get the highest possible vaccination coverage, which will change how transmission occurs and will see us plateauing with our case numbers. But we want to do it at a point where our health system is not overwhelmed, where we don't have dozens and dozens of people dying in Victoria. But when we get to 70% of eligible Victorians getting that first dose, as the Premier said, we can look at expanding that 5K to a 10K radius from home for the purpose of exercise and shopping. In-home care like babysitters can be further expanded to families with primary school aged children if one parent is an authorised worker, and exercise for that additional hour, outdoor personal training, communal gym equipment, skate parks, private house inspections, and the increase in our construction workforce. Again, not dramatic changes, but a step towards that more normal life that we are seeking to achieve. And it can make us feel a little bit closer to normal as we move by increments. But it is about 3 weeks away. We need to get there as fast as we can. We'll make those further assessments as we progress. It may follow the trajectory that we expect, but we could equally see better or more challenging conditions. So we just need to watch each and every day and make those assessments. We know that Victorians want to get vaccinated. We know that they understand that it's not just protection, it is protection from lockdowns, it is the move to the more normal life that we're seeking. It'll help kids get to exams as we go through this Year 12 vaccination blitz for students and teachers. If you're yet to be vaccinated, please book in. We know that AstraZeneca is a great vaccine. Of the almost million double-dosed Victorians who have had that AstraZeneca vaccine, none of them are in ICU now. None of them. So it provides really substantial protection. You have to keep that in mind when you're maybe wavering on waiting for Pfizer that might be weeks away for you. We've got a plan to ease restrictions, but we do need to bend the curve. We need to get to lower case numbers than we might otherwise get to. So please follow those rules. They are still the bedrock. They are still going to be doing the hard work of keeping numbers in check. If you do need support, it is available, financial support in particular. If you have symptoms, please get tested. And if you don't, and you've yet to receive your first or second dose of vaccine, please make that booking and get vaccinated. Thank you. Look, it goes without saying that our efforts remain as strong as they have ever been. And with the complexity of human behaviour, it's hard to know how people will respond to new deaths occurring in the community, these rather awful predictions of cases rising, and our absolute entreaty for people to double down to follow the rules. I hope that still is available to everyone and they understand what it means to do that and how we can still change the trajectory of this. But at the moment, the increase is about 30% per generation of the virus. So every 11 days, 12 days, it's doubling. That's where it's been. We can still change that. We will get to a plateau. There's no question that we'll get to a plateau. It is how soon can we get there? I would love it to be at the end of the week. I'd love it to be today. But the trajectory thus far has been that increase of 30-35% with every generation of transmission of 5 or 6 days. So that's the challenge. And fatigue is absolutely part of it. The complexity of human behaviour is part of it. My advice on playgrounds originally was because we saw that people were using it as a loophole to have de facto meetings across households, neighbourhoods, families. In allowing playgrounds to open again, absolutely with the wellbeing considerations of kids in mind, but we're going to have QR codes as a mandated requirement. It'll be one parent or guardian attending those playgrounds. You will not be taking your mask down to eat or drink because that's when transmission occurs. It's been said across Australia, this virus moves with people. If we don't have those human interactions, we can't infect others.
How many cases have been transmitted at playgrounds?
We have suspicions about transmission may be occurring in playgrounds, but you don't have to jump to specific instances to know how transmissions have occurred indoors and outdoors, between adults, between kids around the world. That's the evidence that's before us, and we know that when people aren't wearing masks because they're having a coffee, and we know that if they're sitting right next to each other and chatting away and they're doing it for an hour, we don't have to have definitive evidence that that person gave it to that person. We know that's a risk, so we can't see those behaviours occurring, and if they do occur again, of course I'll have to come to the same consideration about whether we can have playgrounds open if that's the behaviour that is occurring there, or indeed in any other setting where we see the kind of loophole of these opportunities for exercise or these supports to well-being. Nobody wants them to go away. We understand what it means for people to be out and about.
What's the forecast beyond September 23? That's 70% first dose. The reality is this lockdown is going to last a lot longer. We're talking months, right, if we're looking at these targets. When are we going to hit 80% first dose? And when, more importantly, are we getting to that double dose to get out of this lockdown?
We're certainly due to get to 70% double dose through October and early November for 80% double dose.
Will there be a lockdown until then?
I don't know. We know, and the Premier can speak to it, we know that the real world epidemiology will be just as informative here. We are in circumstances where we're facing a Delta epidemic and racing along at some of the highest per day dosing on a population basis in the world.
So we've got case numbers and vaccination.
That's right, and we are racing and making the time and space to vaccinate as many people as we can. We will see the curve bend on this outbreak, but we also have to follow exactly what's happening in New South Wales to tell us what the real world can also show us, as well as the modelling.
Sorry,
On the issue of what's possible then.
Thanks, Premier. I might go first to that question of how many are out there who are genuine cases but unidentified. Most modelling assumes about 1 in 3 might be undetected. Of course, we can't know what we don't know, but I think it's safe to assume that it's maybe an additional third true cases out there not yet identified. We do get 40+% of people who are symptomatic on any one day getting tested. That's a good figure. It would be so much more useful if it were closer to 100%. On the Delta variant, I just want to say, in general terms, if you're unvaccinated or if you've just had one vaccine, you can deteriorate very quickly. I do want to say, if anyone who's a known case, who's on a care pathway or not, but please be on a care pathway linked to hospital or general practice care so that they can check in with you each and every day. And if you are concerned about your health, if you are concerned that you're getting more short of breath, feel more unwell, more weak, please call an ambulance or contact nurse on call or your GP to check in, because Delta can cause very rapid deterioration. On the changed advice, in a sense, the settings that we're continuing with are still trying to suppress all of the transmission that we've been trying for a month to do. What the reflection on where we're headed is that we've had 2 weeks of increased efforts, really substantially increased efforts, with the closure of playgrounds, with the curfew in place, with constraints on industry caps and childcare arrangements. They have not tipped us into a plateau. We expect that pivot to occur, within 10 days, 2 weeks. We've had that length of time. It hasn't changed. That doesn't mean that the efforts don't continue, and it doesn't mean that a number of the innovations and additional efforts that we talked about even this morning won't be put into place. We're looking at targeted wastewater surveillance for industry and then having industry surveillance testing focused on positive wastewater detections. We're looking at additional things from a community engagement point of view, from a social media engagement point of view that's even more targeted. So there'll be continued efforts, and we've got a period of time with these current restrictions, largely unchanged from a risk point of view. So those efforts continue, but the reflections on where we're headed is really about the fact that we haven't pivoted to a change in the case numbers. It is increasing, and there is a tail of linked cases, known primary close contacts, well controlled, but an even greater increase day by day of cases out in the community and cases of unknown acquisition. That is particularly challenging, and that's really come up in the last few days.
We sort of knew that yesterday anyway, so what was it about today's numbers that's triggered this switch?
Look, as I say, the efforts that we are undergoing have not substantially changed, but the reflections on what has occurred day by day, with a very significant jump yesterday in numbers, really means that we can't be confident that we can drive this back right down. It is on an upward trajectory.
And what if it continues? And it's the question that I asked the Premier earlier, but what if numbers continue to rise at an incredibly rapid rate? What happens then? What are our options until we get to 70%?
We do what we do every day. We have a look at what the drivers might be and try and address them individually. If there are some tweaks, again, it's not all about the policy decisions or the public health directions that are in place. It might be an issue of enforcement, it might be an issue of engagement, it might be an issue that's specific to geography, specific to particular community members, particular age groups or demographics. We will analyse, assess, respond as we always do.
And you haven't reversed the decision on the curfew. What kind of an impact do you think the curfew, and I know it's sort of impossible to obviously just silo into its own mechanism, but what kind of an impact do you think the curfew is having or will continue to have?
We certainly know the curfew is in support of stay-at-home directions. The stay-at-home directions are the policy direction that means that people shouldn't be leaving their home other than those for 5 essential reasons. But the curfew has led to a decrease in traffic overnight. So that to me says that there were people moving about who shouldn't have been moving about because the policing of the curfew is in place, and maybe some of those people were travelling for reasons that would inadvertently put others at risk if they're going to shop or if they're going to pick up food, and you constrain that. But some of them might also have been going for non-permitted reasons, and the policing allows for a closer oversight of that. So it's hard to characterise in full, but I think it's supportive of those stay-at-home directions for sure.
It was about 2 weeks ago that playgrounds were unsafe. Now the measures are about to be reversed. How has the health advice changed?
Well, I've spoken to that. I spoke exactly to that around what we were seeing in playgrounds that were risky behaviours in terms of transmission. We are putting in additional measures like the QR codes, like the one guardian or parent being present only, and for mask wearing to be a strict requirement. Those are things that we weren't seeing 2 weeks ago. I absolutely hope that we'll see them in opening playgrounds, and I recognise the importance of playgrounds for my kids as for everyone's kids.
Why could we not have done that 2 weeks ago? So just on that, if that's right, why could we not have done that 2 weeks ago though?
2 weeks ago we were seeing non-compliant behaviours that were putting others at risk. So the closure of playgrounds was the response to that. And if this is a salutary lesson that you need to make sure that those behaviours that really risk transmission to others, that are ultimately part of what's driving the increase in cases, if you can't see that compliant behaviour, you have to respond to it.
Right, when you're saying that cases are going to be increasing in coming days, what should Victorians be bracing for?
Look, I hope we don't have to brace for too much. I hope that every Victorian can reflect on it. For the vast majority, as the Premier says, who are doing the right thing, please keep doing the right thing. It's a hard slog, but it is a huge contribution to keeping a cap on numbers. And I don't want to say that community policing needs to happen across the board and everyone needs to dob on everyone else. But if you are invited to break the rules, please speak to those individuals who are inviting you to do so, to say why it's really important that you don't, because you could be carrying the virus without symptoms, without knowing it, and putting the very people who are asking you over to their home, over to meet, at risk. That's what causes transmission. The virus moves with people. If you're invited to move in ways that you shouldn't be, please decline.
Mandating or strongly encouraging local councils to have COVID marshals at some of the busier or bigger parks and playgrounds?
Look, I think we'll keep an eye on it. Again, if people understand the seriousness of this disease that's killed 4.5 million people globally, where there are, on this day, another 200,000 cases in the US, with their high vaccination rates, another 1,000 or more deaths occurring there. If people understand the seriousness of it, I don't think we need COVID marshals everywhere. We just need people to reflect on how deadly this awful virus is.
Just back on proportionality, we do have a vaccine coming. So in terms of treading water for the next 8 weeks or 12 weeks, whenever November, December is, we've essentially ruled out Father's Day, Grand Final Day, potentially the Spring Racing Carnival, in terms of even just getting together with a small group of friends at a park. So in terms of the fatigue and why you think that's proportional for us, even though we've got a comparatively low number of cases and vaccines on their way and increasing, no one wants to see more deaths, obviously, but how do you think that that's justifiable to the Melbourne population?
All of these epidemics in every single country started with a single case. So the idea, and I've heard it so many times, especially in social media, what are you locking down for X number of cases? Well, that's true today, and it becomes an absolute falsehood a month later. We have to understand what the trajectory is and what the modelling and the real world experience in Victoria in particular tells us about an exponential growth rate. An exponential growth rate isn't the same number of cases being added every day that add to our hospital system and our hospitalisation ICU. It is a growth on the daily number that we're seeing every day, to the point where it doubles every 11 or 12 days. That is a really, really significant risk to us as a population and as a health system response that crushes all of those things that we want to provide, not just for our COVID patients, but for everyone else who needs that access each and every day. And the burden of illness that we could get to with thousands of cases per day. If you're at 3, 4, 5,000 cases per day, you're looking at an epidemic curve that isn't the 20,000 that Victoria had last year. It's 150,000, it's 300,000. That is not out of the question if you've got a significant increase in cases. That's what I have in mind in my decision making.
A lot of the polls that have been taken, though, show that Victorians are quite concerned that the cure is almost worse than the disease. I know that may not be true, but that is the community sentiment. So
I don't know that that's the community sentiment. I know that there are people who are concerned about all of the awful consequences of lockdown. I'm concerned about them as well. My team understands what's being weighed up in those decisions, and again, we have the experience around the world, as well as through Victoria's second wave last year, about exactly how many people might become unwell and how many people might die. And there are countries in the world that have doubled the number of people who have died just with COVID illness. Brazil, that really took a no lockdown, no mask, no vaccine approach almost. One in 200, 1 in 300 people, not just infected with COVID, of the population.
no one wants to see that, but I'm just saying, is this as far as we could go right now, opening playgrounds? You couldn't allow 3 people from 3 different households.
As the Premier
outside.
said, you start with a package. You need to see whether that can hold things at a rate that is manageable, that doesn't have this exponential increase become unsustainable very quickly, where you need to do even more that is even more harmful from a lockdown point of view, because you're needing to keep control of things. So we will move slowly and cautiously in making sure that the things that we introduce don't put us into that dangerous category. But in terms of keeping an open mind about all of those other things that might support us in our mental health and our well-being, they are absolutely in mind. We'd all love Father's Day. It is just around the corner. I remember my father who died 43 years ago on Saturday. we'd all love those occasions to meet our family members for those really significant moments and those big occasions and sporting events. We want to try and make them happen. But in terms of the crowds and in terms of human interaction, we need to bear in mind that that is just another opportunity for us to make others around us sick.
Recent polling has, though, shown
Last
that
question.
Victorians are more concerned about job losses and mental health than the virus itself. Are you worried that this could create a level of resentment in the community and lead to people not doing the right thing? Because there isn't a lot of freedom being offered here.
I hope not. But again, those purported economy first approaches, and again, Brazil were pretty explicit about that pathway, saw a huge economic hit. And that was from the illness that occurs, everyone who's taken out of the workforce, everyone who's hospitalised and dying, but also everyone who needs to protect themselves from the rampant transmission that's occurring in shopping centres, in workplaces, in those human interactions. So the idea that there's not a trade-off here, you have to recognise that there'll be a huge hit to the economy in opening up when we can't control numbers.
Just got one more question for the Premier. Oh, sorry, Steph, you go.
Just a quick one.